Alrighty, well, welcome everyone and good afternoon. Welcome to our June Healthy Eating Active Living work group meeting. Glad to see everyone. It's been a long 2 months since we last met, so good to see everyone today and hope everyone is doing well. To kick us off today, I want to do quick introductions, so you can feel free to use the chat function, or if anyone would like to come off mute and introduce yourself with your name, your organization, and our icebreaker today. How do you promote healthy eating and active living in your community? And I can go ahead and kick us off. For those who I have not met yet, my name is Taylor Palmer, and I am with the Prince George's County Health Department. And my primary role is overseeing our Prince George's Health Action Coalition. So, for those who are just joining us today, our Health Action Coalition, we have four work groups within our coalition. So we have the Healthy Eating Active Living work group that you all are a part of. We have a health equity work group, a behavioral health advisory group, and a community care coordination team as well. So those four work groups are all under our coalition at large and all carry out our community health improvement plan. So really excited to see you all and thank you all for giving your time to this important mission. And another task that I work on is our community health assessment. So excited to share the updated community health assessment with you all very shortly. And then we will have a new community health improvement plan coming very soon. So again, thank you all for your partnership and looking forward to our discussion today. Is there anyone else who would like to do an introduction? Anyone new joining us today?
Sure, I can go ahead and introduce. My name is Ashley Morris. I'm currently the Preparedness and Outreach Manager at Prince George's County Office of Homeland Security Emergency Management Division. My group oversees all disaster and emergency management preparedness with the county, and we do quite a bit of training and outreach for residents in Prince George's County.
Thanks, Ashley. Good to meet you.
I can go next if that's okay. I am not new to the meeting, but my name is Rimple Gabri. I am the outreach clinical pharmacist with Giant Pharmacy. The way that we promote healthy living is that we actually work with a nutritionist team. We have a group of nutritionists that work with healthy living, and we actually offer consultations in store and outside of store. So we come to you off-site for group organizations and offering the nutritionists offer demos and healthy food choices, and they definitely have more of an elaborated program. Of course, and from my clinical side, we do in terms of, even though it's not so much of a healthy eating, we are promoting vaccinations. We're definitely very much involved in the community outreach. We come to your organizations and we do the vaccinations there just to make sure that it's convenient for all the community, whether they're senior population or younger population. We're out there in the community to make sure that everybody has access to various vaccinations.
I will piggyback off of Rimple since I work with her. My name is Vimisha or Vimi Patel. I'm also a pharmacist with Giant Food. So I work closely with Rimple on our mobile clinics, which we take out into the community for vaccinations. I work in store as a pharmacist, trying to make sure people have their medications so they can stay healthy, doing vaccinations in the store. I am also a CPR instructor, so we take our equipment out to the community and teach CPR classes. So hoping to keep everybody healthy and doing well.
Great. Well, thank you both to our Giant team. We usually have Leslie Jefferson on the line, who also comes from Giant, and really great to have this partnership and also to be able to share your resources. So if anyone would like to get in contact offline, feel free to include your information in the chat, and we will certainly connect with you all after today's meeting. Would anyone else like to do a quick introduction?
My name is Gwen Hector. I'm with Environmental Health, Food Protection. We do various stuff over here, like the department that I work in. We are the one that regulate the restaurants, grocery stores. We do the plans for new restaurants. We are the one that, like for water breaks and different stuff like that, we do. Our other department is the one who basically do the air quality, the pools, the trash truck, etc. Kind of all too fast, right? But our manager is Evelyn Hobart. Basically, that is it.
Wonderful. Good to see you, Gwen. Thank you so much for joining us.
Okay.
Anyone else? Alrighty, well, feel free to include your information in the chat. Always good to know who we are connecting with today. And thank you all again for joining us. For our discussion today, excited to introduce our new co-chair. Devin is joining us today, so excited to introduce Devin to you all. And then in recognition of CPR Awareness Week, we have 3 different resources that we will be sharing with you all. So excited to jump into that discussion and talk about local accessible resources that are available to our community, to your organizations, to your businesses, to hopefully get these resources in the hands of everyone and anyone. And then we will wrap up with our community announcements. And so first, as we always do in every meeting, we always like to ground ourselves in this central mission that the work group is working towards. So the Healthy Eating Active Living work group envisions Prince George's County as a place where everyone has access to fresh, nutritious food and environments that promote good health, wellness, and active living. So thank you all for your efforts working towards this vision, and excited to have our discussion today to advance this vision. So first, I want to do a warm introduction to our new HEAL co-chair. So working with Anthony Nolan, our other HEAL co-chair, and Jessica Moyes, Devin Hardesty will be joining us. Devin is with the Department of Parks and Recreation here in Prince George's County. She's been with the Health and Wellness team for over 2 years and has overseen several programs, including the Fitness in the Parks and yoga and different programs with QR Fit Trail data recovery. And she also oversees evidence-based programs such as the Fit and Strong, and facilitates different monthly observances and special events. If you've ever been on their calendar over at Parks and Rec, they always have different events going on. And I know Devin works very hard to maintain that calendar and to bring in new activities to our community. So very excited to have Devin here on the HEAL work group, and her contributions to the Prince George's County are especially notable. She previously worked with the Baltimore City Recreation and Parks, and then she also ran her own successful fitness training and consulting business. She believes in personal wellness and really hopes, and she really engages with all of those in her network, all of her clients that she works with. And as you can see here, she is driven by their stories of progress and healing from those clients. And those are her greatest accomplishments. So as you can see, very selfless. Devin is able to join us today. Thank you so much, Devin. Really glad to have you and look forward to your leadership with the HEAL work group.
Thank you so much, Taylor. Hi, everyone.
Alrighty. Well, without further ado, we will go ahead and jump into the meat of our presentation today, which is an observation of CPR and AED Awareness Week. So excited to have, again, 3 presentations for you all. We'll have our first presenter, Ashley. She's going to talk to us from the Prince George's County Office of Homeland Security Emergency Management Division. Then we'll go into some resources from Giant Pharmacy, and then we will wrap up with an overview of the American Red Cross and some of those online resources that are accessible to our community. So Ashley, I will go ahead and hand it over to you.
Great, awesome. Good afternoon. I just want to thank y'all for the partnership, and also thank you for giving us an opportunity to talk more about our resources. I do not have slides to share for this. I'm just going to brief out kind of some of our resources, and then I'm also hoping to share in the chat some of the links and areas that you can find where to sign up for classes and share with the community, your employees, or anybody who's interested. So our agency with Prince George's County has been supporting first aid and CPR certifications for the past few years. We have two different programs that we offer. One is actually a Prince George's County employee CPR and first aid program, where we host typically anywhere from one class a quarter to once a month, CPR first aid class, which does give you a 2-year certification in first aid and CPR. We typically host this class on site on Anchor Street in the Landover area where our office is. And it's usually available for up to 25 staff based on registration. For county employees interested in that, it is free. They can actually find our employee classes on the NeoGov website. So if you're used to signing up for training through the county, you go through NeoGov, learning, take a look at the courses, sign up, and then you can come and attend. I do want to just clarify that this is not a medical grade CPR certification. So I know sometimes we get health practitioners and some folks who need it for jobs. This is more of like a civilian level first aid CPR. So it's great for, non-professionals who just want to learn more about CPR and first aid and have a certification. We do pay a contractor who it's actually with Capital First Aid who comes in and administers the classes. So we use grant monies for that. So we're not putting it on ourselves. And that's for the employee. Now, our other program is for the residents. So we offer the same exact certification program for residents, and we schedule these at least 3 or 4 times a month. We typically have 2 community resident CPR classes open to anyone. And again, they're on our site at our agency on a Saturday. So usually 10 a.m. or 1 p.m. folks can choose. It's open for 20 to 30 people. And to sign up for those, we have an Eventbrite link that our agency uses where we're posting classes, we're putting it out on social media, people are signing up, and then they're coming to our class for that. Outside of that, we also offer a Spanish CPR first aid certification. So again, it's the same exact class and program, but we actually get a translator to come and attend, and our vendor has Spanish resources as well. And so our outreach team works with different areas in the community to book that so that they can target areas that require Spanish access. And we usually fill those classes pretty successfully working with OCR as well. And then lastly, historically, we have done group CPR requests. So occasionally we might have a house of worship or a community group want to put on a large class and host it. So we would work with them to host it, send the vendor out and things like that. However, with just federal grant uncertainties and freezes and things like that, we have not been able to do that part of our program right now. And that part of our program is a little bit on hold until we figure out about funding. But that's pretty much all I have. I do want to just clarify that, again, this entire CPR certification program is based on Homeland Security grant monies. So there's always a little bit of uncertainty of whether or not that's going to continue moving on in the future. But for now, we continue to host that now until we get more answers from the federal government. But with that, I will take any questions, and I will also make sure to drop my information in the chat as well as the links to where people can sign up.
Thank you so much, Ashley. Any questions?
Ashley, I have a question. So when you have these grants from the federal government for your homeland security, are you able to also have grants for community projects like doing vaccinations as well?
That's a good question. So the money that we typically use for this program comes from specifically 3 grants. One is a UASI, which is kind of based on terrorism prevention. Another one is called Homeland Security. So it is a post 9/11 security or a terrorism grant. And then we have one other one that's emergency management grant that's a little more geared towards disaster management. And all of those come down from DHS, federal government, down to the state and the local level. We do have stipulations, especially on the Homeland Security grants. They have to go towards terrorism, either response or prevention, which typically we can get away with using, training that we might need during a terror attack or something like that. But EMPG gives us a little more wiggle room with preparedness funds. So we're kind of strapped with using those for that. If those were to go away, because obviously there's questions on whether or not DHS is going to push those down. A lot of those are frozen and being reevaluated. I'm not sure if we would be able to apply for another grant. We would need to kind of search for something else. But I also do know too, like in terms of like vaccination and some of the public health stuff, that's taken care of with our public health planners in the health department and outside of what emergency management and disaster management takes care of.
Got it. Thank you so much for that explanation.
Yep.
Any other questions or anyone interested in pursuing some of those resources that Ashley just described? I know as a county employee, I'm very excited to hear about this opportunity and excited to learn more about it. I was not familiar with it. So thank you again so much, Ashley, for joining us. And I will be sure to include any links that we're able to share today in the meeting notes so you all can share those with your networks and be able to reference after our meeting today.
Absolutely. Thank you. Feel free to reach out if y'all have any other questions.
Thanks, Ashley. All right, and then next we will go ahead and transition over to our giant pharmacy team. So Misha and Rimple, whenever you both are ready.
Great. Thank you so much. Taylor, Vimy, are you ready to dive in terms of introducing yourself and the program that entails the details on the program?
Yes, absolutely.
Wonderful.
Okay, so again, my name is Vimisha or Vimy Patel. I am a pharmacist with Giant Food. Also became a CPR instructor a couple of years ago so that we can provide CPR classes to our pharmacies, or pharmacists, excuse me. And then our illustrious director thought it would be a great idea to be able to take these classes out into the community. So we do go to area businesses, organizations. We've gone to churches before to provide these CPR certification classes. So our classes are $69.99 per person. We do request 6 people per class, and we can do up to 24 in a given class. Of course, we can do multiple classes, as we have done in the past if we've had more people. We do provide some demo classes. Rimple, I think you can talk a little bit more about those. I haven't done any of them. But then after our class, after the full certification class, you do get a CPR certificate. As Ashley mentioned, they're good for 2 years. And I think it's a great service. I'd like to share this one story from one of my classes. The director of this organization, he had a heart attack, was a very fit individual, swam, ran, came home, wasn't feeling very well, told his wife that he wanted to go to urgent care, an emergency room, and he went upstairs to change. Before he ever even got upstairs, she called 911, unlocked her door, and found him already passed out upstairs. So she had to provide CPR for over 12 minutes until EMS had arrived. So it's just a great service. Everybody should learn if they can, even basic CPR, just so that they can help a loved one. We have to do it in the pharmacies for any medical situations in the store, but most often you're going to find it a family member or a loved one that you provide CPR for. So if everybody has basic skills, we can keep the world rocking.
Thank you so much, Vimy. I'm just going to piggyback on what Vimy said. So yes, we require a minimum of 6 participants for our CPR classes, but that is, we can definitely also organize for larger groups. So the best part is that we come to you. So if there's an organization, a nursing home, whatever the reason might be, time constraints for a lot of employees, it's a great convenient service because our trained CPR educators are able to come to the site and we can manage larger groups. So if I believe there's one CPR instructor to a group of 12. So if there are more than 12 people, we can definitely bring more CPR instructors. And we actually have done quite a few that are even out of state. And we have been able to go and travel and stay overnight and then take care of the individuals the next day. So it is quite a essential and a convenient service. As far as Vimy mentioned, the CPR demos, those are basically to kind of give them the knowledge at a quick hand when we are out and about in community outreach events, whether they're school fairs or business organizations such as picnics, or in the fall we do a lot of October harvest fairs, fall fairs. We're there out and about just to kind of let people know what our services are. And the CPR demos is basically we bring the actual CPR mannequin and we're able to show essential tips and techniques on what to do. So it's abbreviated demonstration, but nonetheless, it really does impart a lot of information, good information for somebody that's on the go and just wants to get a quick refresh, or even if not a refresh, just a new awareness in terms of how to handle in a situation, God forbidding if that does happen. And if they do want to sign up for a full-fledged class where they actually get a certification and they're allowed to do it on other people, then of course we can come to you and do those classes.
And I'm curious, Ashley made the distinction between civilian level and medical level CPR training. Where does Giants training fall? Is it more civilian level training as well?
So I'd want to say we do both. There is an abbreviated smaller class, which is more for civilian training, but I could be wrong. Vimy, do you want to elaborate on that?
Mostly it is for healthcare professionals, but it's probably not necessarily for like hospital. So I would say it's more on the basic level, civilians, and enough for pharmacists to have a little bit advanced care, because we do use a bag mask valve, which most people in the community are not going to have. So I would say it's a little bit of a hybrid. It is basic life support with AED training, and it's hands-on. Whereas I think some of the classes, they don't have the hands-on. If it's a civilian class, you can do them online for some of those cases. But as for healthcare, we have the hands-on portion, which kind of makes it an advanced certificate, I'll say.
And I believe that we also do infant choking training as well. So that is also part of the basic life, the BLS educational class that we offer. So it also does show in terms of how to prevent, or what to do in terms of infant choking, the CPR that you would apply versus on an infant, child, and an adult. So it does go through all 3 different stages of how to handle in a specific situation. And like Vimy said, it's definitely hands-on. Do use the AED device, and So it is quite elaborate, but I believe that really anybody can sign up for it because we have done it for members of a church. Very similar situation. There was a member at the church at the service, experienced a heart attack, and they had to call 911, and somebody just happened to know CPR and were able to bring them back. So a lot of churches have been very interested in our services because of the law, the large congregations that they hold. They believe that it is such a vital service to be able to provide such service. And, anything can happen at any time. So to answer your question, yes, for medical health professionals, but also for everybody as well.
Thank you. And also for individual community members who maybe aren't a part of a large group that just find out about your services, does Giant do anything to possibly match those to a larger group that they could receive this training, or how would individuals go about accessing your resources?
So for the individual groups, we are still in the process of figuring out. Those details have not been so much ironed out yet because we have to find a place within our stores to be able to provide that kind of a service, which is also safe for everybody, how accessible it is for everyone. So we're still trying to work out more on the details for individual basis. But if there is a group of even 6 and there is a place where they can provide, we will come to them. So the only reason why it's a little bit of a challenge for us in terms of individuals is because really of the space. We want to make sure that it's in our stores, even though our employees are very much well aware of the grounds they're walking on. We want to make sure it is absolutely clear cut for anybody that's coming into our store because it's a liability issue. So we're still trying to figure out the details in terms of where we could provide, whether it's going to be at our headquarters, which is not always an accessible place, but yes, it's a possibility, and we are trying to figure that out. Hopefully we'll have that implemented in the next few months.
Got it. Thank you. Any additional questions? I'm going to ask a question to all of our presenters. So we've chatted a little bit about understanding the importance of everyone getting trained to be able to administer CPR if put in that position that they need to. Um, how do you all convey the need for folks to get trained? Maybe if this isn't on someone's radar, they don't necessarily see it as important. How can we reach those pockets of the community where they don't necessarily have that perceived need? They're not yet reaching out to your office for the training. How can we kind of get them to see and acknowledge the importance of getting trained and administering a CPR and AED?
If I may, I think the best way is to just have them have access to our information, such as my email, and then I always kind of like trickle it down to Vimy. So having one person's contact information is very important if they have any questions. That's why we do a lot of outreach and community events, and sometimes we just do the CPR demos. As just as an exchange of information in terms of how vital it is, because a lot of people, I think the main core issue is understanding how important it is and how it really does save lives. I think that's the message that sometimes we have trouble getting that across, because once we hit that message on how important it is, people will make time to figure out how to sign up for a class. And I think just understanding that it is an essential life-saving skill, everyone should have it, whether it is a mom with small children to all the way having aging parents. It is a service that does save lives. So I think that is one of the reasons why we're so active in the community. And I mean, any opportunity that we get, it's the same thing for in terms of vaccinations. vaccinations may not be so apparent in terms of how it saves lives, but it does. It keeps you healthy. It keeps you out of the hospital. So same sort of a mindset in terms of when we talk about our CPR classes and why it's so important. It is a life-saving skill. We're out there as much as we can in our community events. I, as an outreach clinical pharmacist, tries to kind of just go out there and even calls to local organizations, schools, churches. And that's really the key, is to how to be involved in the community and as much as we can. But any kind of group efforts that we can get, especially like from a call like this, because we have so many partners from different organizations on this call. It's all about, spreading the message. So if we can get each other's help and saying, Giant does this, that would be tremendous help. And that's how these calls are so essential, and we get so much out of them, is because we're working as a team to keep our community safe.
Thank you, Rempel. I think exactly what you're getting at there, in talking about the bystander effect. And I hear that excuse so many times when I'm out in community, that the assumption is that there will be someone in the crowd that is trained, that is CPR trained. And so really getting these skills into the hands of as many Prince George's County residents and beyond is essential. And then, what you talked there about the severity of, being on the flip side, not trained. And what does that mean, in a life-saving situation, and just the being able to talk about the perceived severity and susceptibility there. Any other questions or comments? Any ideas on how to get these resources out? Anything that the HEAL work group can do in particular to help promote these life-saving resources? I'm curious, has anyone on the call received any training, any CPR training before through their organization? Certifications up to date? Awesome, awesome. Well, thank you so much to our presenters. This may be an awareness week, CPR awareness week, but it should be a CPR awareness year. We should have this year round. I certainly look forward to sharing all of your resources to our Giant team. If you all have anything that you would like us to get out, feel free to email or put any links in the chat, and we will certainly get those out in our meeting notes.
I appreciate that, Taylor. I did put down my email address and a little bit description of what we do out in the community. So please feel free. I'm sure everybody has access to that chat, but if you want to just send it out in an email format after the call, that would be tremendous.
Really will do.
Thank you.
All right. And next, we wanted to highlight another available resource. Again, just hoping to throw as many resources at you as possible so you can deem what is best and most accessible to you and your community and your organization. So here is the resources from the American Red Cross. So you can go in, I will put the link in the chat, and you can look up by zip code or by specific area and be able to find any sort of class that you're needing, any sort of training opportunity that you're looking for. This drop down, as you can see, they have so many different training opportunities, paying attention to CPR and AED for our presentation today. But you can go in, I have Largo as my location, but as you can see, several different online trainings. As Rempel mentioned, we've got some adult and child and baby first aid. So definitely very important. Ashley put in the chat as well that her organization provides infant training as well, child CPR resources. And so you can go in and you can play around with the different locations, the different dates, and find a date that works best for you, your organization, or your loved ones. So I will be sure to include this in our meeting notes, but wanted to highlight this as well, that these are also some accessible resources to folks that are available in the community, but then also in a virtual landscape. And you can take a look again here and go through to see different information on the CPR training. You can get a little bit more information about telling again to the community why is this important. You can find those training resources. They've got different audiences for schools, healthcare providers, employees. Many of the audiences that you heard mentioned today also translate over to this Red Cross resource, different videos that you can interact with, and all of those helpful items. So again, keep the Red Cross in mind for different trainings, again, for individuals as well as organizations. Devin, was there anything in particular that you noticed from the Red Cross site that you wanted to call out?
Sure. Yeah, they had a couple. Well, first of all, good afternoon, everyone. Again, thank you so much, Taylor, for the introduction earlier. I appreciate it. Yeah, there were a couple of helpful resources that I wanted to share from the American Red Cross. I don't have slides, so I'm really happy that you have this page up to help kind of showcase what we're talking about. But I have a couple of resources that I'll also be sharing in the chat in just a moment. I wanted to mention that I just completed the online portion for CPR training and will do my in-person training this weekend. So this conversation is like absolutely perfect timing. And I appreciate what everybody's shared so far. Just wanted to also mention that we know that we have access to CPR, having access to CPR resources is crucial, as everyone said, because timely and effective CPR can significantly increase the chances of survival in cardiac emergencies and other emergencies. So knowing how to perform CPR and having, the proper use and training for AEDs and administering first aid empowers individuals to act quickly and confidently in life-threatening situations. So these resources will help highlight the steps that will help people to recognize emergencies and perform potentially life-saving actions. So again, I'll place the resources that I have within the chat, but I also wanted to say that the Red Cross outlines kind of a structured approach to CPR training that includes recognizing signs of cardiac arrest, calling 911, delivering high quality chest compressions, providing rescue breaths, and using AED if one is available. Also, just wanted to mention that there's a wide range of CPR and emergency preparedness resources that are vital to community safety, much more than what I'll be sharing later on. As our presenters mentioned today, they provide CPR and first aid for individuals, schools, and organizations, including both in-person and online courses. These courses teach life-saving skills such as chest compressions, rescue breaths, and how to use AEDs. AED is automated external defibrillator. In addition to the training, the Red Cross also offers certification programs, mobile apps for quick reference and emergencies, and community outreach initiatives. So yeah, I just wanted to share a couple of the resources that I have that I've pulled from the American Red Cross site, and just feel free to take a look and give it a quick check when you get a chance.
Thank you so much, Devin. Out of curiosity, so is the online component, does that also require the in-person component? So you complete most of your training online and then you have to go in for like an in-person demonstration?
Yes. So there's kind of the testing portion. So the online portion is where you have different modules. I believe there's 7 modules that went over first aid, AED use, CPR training, the actual compressions, how the depth of compressions for adults versus children and infants. So you have that online portion. And then when you go in for the in-person, there's that practical putting into use. They actually have the mannequins out, as somebody mentioned, and you get to actually do the compressions on the mannequin. If you're not going deep enough into the compression, there's a light that won't light up for you. And if you do, it shows like green, like you've done it correctly or something like that. But it's just that really good practical use in person where you can put it into practice and actually practice the calling out to even people to designate who will be going to get the AED or who will be going to get to call 911. So it really does put people kind of in that mode. So you can really practice and not have that, that freeze that can happen when folks are called upon to, in an emergency. So yeah, that online portion is great, but that in-person portion, it's a good 6-hour program, that in-person portion this weekend. So we'll spend some good time. And it's good to do it in a group setting and have that instruction there. So it's actually, yeah. So this is perfect for me. This is, exactly what I'll be going over.
Thank you so much. Any other questions or comments about the CPR resources that were discussed today? Or any other questions for our presenters? Alrighty, well, thank you again to our presenters for agreeing to come today. Again, it's all about educating and empowering our community, and really glad to have your resources here in Prince George's County that we can allow folks to access and again, be able to share with their community. So I encourage everyone who is on this call, please be on the lookout for these meeting notes, for this meeting recording. Please share it with your networks, anyone who is interested. As was previously mentioned, it's through any of your networks that you may be a part of. So someone mentioned a church community. If you have a faith-based institution, if you have any of your work colleagues or any of your friends, think about those networks and getting these resources to those folks. And with that, we will go ahead and transition to our community announcements. So first, coming up next Tuesday, we have our in-person Prince George's Health Action Coalition quarterly meeting. So as I mentioned in my introduction, this is my primary role managing our local health improvement coalition. So each quarter, our coalition at large gets together in one room. This quarter, it will be in person, taking place at the Parks and Recreation Administration building over in Riverdale. So if you are able to join us, we will be talking about legislative updates. So much happened this legislative session. And as you know, with things happening at the national and federal level, things are going to fall on the states and at the local level as well. And so we want to be sure that we equip our community with the knowledge and the resources moving forward to be able to advocate at the local level for impacts that you may be seeing in the community and for some of these very important resources that we know need to be sustained. As Ashley mentioned, money is getting tight, and so we need to be able to advocate for funds, for maintain funds in some areas. And we want to be able to equip you all with the knowledge, but then also to be able to do a review of what happened at the state level, what happened in this legislative session, what passed, what didn't pass. I can imagine as everyone is so busy, sometimes policy can really fall off the agenda. And so we want to make sure that we are discussing policies that are directly and indirectly impacting Prince George's County communities, and to give you all the resources to be able to react and be able to advocate towards action moving forward. So I will go ahead and put the registration link in the chat for anyone who is interested in joining. This is an open community event, so anyone who you know in your network who would be interested in joining us that afternoon, please feel free to do so. I see Krista's already got the registration link here in the chat. Thank you very much. Feel free, go ahead and register, select your meal. We've got Sardi's Catering. I've got vegan, vegetarian options as well. So please do feel welcome to join us next Tuesday evening at 6 p.m. And next, from our friends over at the American Heart Association, we've got a save the date for the Rural Health Summit taking place in Arlington, Virginia next Friday. So anyone who is interested, I will share out this flyer to you all. Sounds like it will be a great session to get some folks in the room. I know with just how large and robust Prince George's County is, we have some partners who are calling in from more rural regions of the county. So look forward to having those folks in the same room with folks from the American Heart Association to learn more about the association's action agenda. So I will be sure to send this out to anyone who is interested, again, attending in person next Friday in Arlington. Next, from our friends over at the Food Equity Council. So for those who are not familiar with the Food Equity Council, IPHI, the Institute for Public Health Innovation, oversees the Prince George's County Food Equity Council. They are having their meeting next month. It is going to be taking place Tuesday, July 22nd from 4 to 7 p.m. This is an in-person event taking place at the Prince George's Sports and Learning Complex. So I will be sure to share out this registration link to anyone who is interested. It'll be a really great panel discussion talking about urban agriculture. They're going to be talking a little bit about community gardens, what do green spaces look like in Prince George's County, and some of those innovations that are new and upcoming. And anyone who is interested in talking about community gardening and being able to advocate for more green space here in Prince George's County. Also, if you aren't a part of the council already, you can join. Those are, again, open meetings to everyone in the community. Those Food Equity Council meetings, they take place, I believe, once a quarter. So please feel free to join this one as well, taking place next month on July 22nd. And then next, exciting opportunity coming from the Prince George's County Council. There is a non-departmental grants program that is now available to 501c3 nonprofit organizations. So I will put the information here in the chat that gives you a little bit more information about this letter of consideration that is due on Thursday, July 3rd. So again, if you're interested in this opportunity as a nonprofit organization, there are some online resources to review if your organization is interested. And it has some important information here about, for example, how to address the header of the letter and some information about what they will and will not fund. So if anyone, again, is interested in that opportunity, I will put the link here in the chat, and please share with your networks as well. And then lastly, I will include these flyers in our meeting notes as well, but from our friends over at the Community Engagement and Consultation Group, they are having different food resources available each month during the summer months. So starting, actually started back in April, but it's going to be running through the summer months every other Friday. Folks can come into their office, CECG's office, and they can get information on SNAP services. They can receive donated goods, get some food referrals, and also talk to specialists about Maryland Medicaid enrollment. And then also CECG is offering the Harvest of Loaves that gives out free loaves to folks who may need that resource. So if you know anyone in your networks who could benefit from these food services or some care coordination efforts, please share these flyers with them or feel free to post them on your websites. And with that in mind, that is the extent of my community announcements today. Are there any other community announcements or upcoming events that anyone would like to highlight?
Sure, I have a couple from Department of Parks and Recreation, Prince George's County. Just a couple things I'd like to share. Our summer programs have started, so we're excited about that. Summer camps and summer playtime programs have begun, and our fitness and yoga in the parks classes have started. So I'll share our fitness in the parks, yoga in the parks flyer for in the chat for everyone to check out. Please come out to these. These are free classes that take place all throughout the county. So we'd love to have you join us for those. Also wanted to mention that our outdoor pools are open. So it's summer has begun. So it's nice to have all these things going on. Also wanted to mention that our summer concert series and our summer movie nights, I believe it's called, those are getting started. And both of those information for both of those can be found in our 2025 summer guide. That can be found on our website, pgparks.com, by clicking your guide. So if you want to find out about any of those programs, please check it out on pgparks.com. And again, I'll be putting our fitness and yoga in the parks flyer or rack card in the chat. Thank you.
Thanks, Devin. Any additional community announcements? Alrighty, well, we will go ahead and wrap up for the day. The next HEAL meeting will take place on Wednesday, August 6th. A personal note from me, this will be my last meeting with you all. I am transitioning from leading the coalition, so I will soon be transitioning to another department here in the health department, but it has been such a joy and such an honor to work with you all. So you will see a new face leading the calls moving forward when you all come back in August, but I hope you all have a wonderful summer. Take a vacation. Please get some relaxation. You all have more than earned it. And thank you all again so much for all of your hard work. It has been such a pleasure working alongside you, and I cannot wait to see what the HEAL work group does moving next.
Thank you.
Thanks, everyone. Take good care.
Good luck to you, Taylor.
Good luck.
Thank
Stay
you, Rimple.
connected.
Congrats.
Bye.
Thank you, everyone.
Hi, Taylor.
Bye, everyone.